So today I'll be administering medication via piggyback according to the physician's orders. Before we want to give the medication, the first thing we do is we want to make sure that we have the proper medication, the proper volume, and the proper patient that we're going to be giving it to. So before we do anything, we want to make sure that we have our medication with us, and we're going to do 3 simple checks. So the first check that we want to do is we want to check the dilution of the medication. So we want to ensure that there's enough volume to dilute the medication so that it doesn't exceed the final max concentration. The next thing you want to do is you want to know the amount of volume that you're going to be administering, plus you have to also add the flush that you'll be administering. And then lastly, what you want to do is just determine the rate that the physician wants you to give to the patient, okay? So now that we have that, usually it'll have a sticker that says all that information. If not, you go ahead and make it yourself, and then we'll stick it on to the medication. So now that we've done that, the next thing we're going to do is we're going to go ahead and introduce yourself as a patient. So I'll walk into the room. I'm going to introduce myself. Hi, my name is Kelly, and I'm a nurse. And today I'm going to be administering your medication via piggyback according to the physician's orders. So before I get started, let me go ahead and just check your patient IDs. And then we're going to check this against the MAR. So we want to make sure that we have the correct patient. So Matt Medina. Then we'll check against the MAR. Perfect. Next thing I want to do is I want to just go ahead and explain the medication to the patient. So you're going to explain to them in the simplest terms what is the medication for, and also what's the side effects and what they want to look out for and how long you're going to be giving it to them. Before we do that, we also just want to make sure that the patient's comfortable with it and to see if there's any contraindications such as allergies that would prevent us from giving the medication. So now that we've gone ahead and explained it to the patient, what we want to do is check the patency of the IV line. So right now we have a running IV, and everything looks perfect, and it's running in the patient right now, so we know that it's patent. If it was not running an IV, another method you could do is using the 10 cc saline. We would swab the port, the closest port to the patient, and then we'd use the push-pause method to ensure that the IV line is still patent. So I'm going to go ahead and begin and just do the hand hygiene. We've checked all of our patient rights to ensure that we have the proper medication, the dose, the route, the time also. What we're going to do is go ahead and open our secondary tubing. Perfect. Now that we've opened our secondary tubing, what we want to do is get our medication. And using medical asepsis, what you want to do is go ahead and open the medication bag. Then you want to ensure that when you spike it, that you're spiking it, maintaining medical asepsis. Go ahead. There you go. We have that on. Then we're going to go ahead and hang this on to the pole. So the next thing we want to do is we want to attach it to our primary line. And before we attach it, we also want to ensure that the medication is compatible with the primary line, with the primary fluids that's running, okay? So I've done that and they are compatible, so I'm able to go ahead and connect these two. And what we're going to do is we're going to go ahead and get an alcohol swab, alcohol prep pad, and then we're going to get it to the topmost port that's closest to the primary. We're going to swab for 15 seconds. Go ahead, put that in the trash, connect it. So now that we've connected it, obviously the line is still clear. What we want to do next is we want to do some back priming since the medication are compatible. What we're going to do is we're going to go ahead and take our medication, and then we're going to lower it and allow it to back prime via gravity. So I'm going to go ahead and you see the bubbles, which means that it's back priming. Perfect. Let's go ahead and close it. Now that we've had that set up, what we're going to do is with our pump, we're going to go ahead and click our piggyback mode, and then in the rate, we're going to put the prescribed rate. In the volume, we're going to put the total volume of the medication plus the flush that's required so that the patient receives all of the medication. And then we're going to put the the rate that also has the flush with it. And then now that we've done, we'll go ahead and take this off. What we want to do is we'll get tubing, and the sticker is basically going to say when we attach the secondary line with the piggyback, and when we're going to put the date, the time, and also our initials. So I'll go ahead, place this on here, so that other nurses know how long the tube's been hanging out for. So now that I've done that, I'm going to go ahead and mark that I've given the medication, and I'm going to document all of the things that I've done. And then I'm going to ask the patient before I leave if they have any more questions about the medication or if they have any concerns. And if not, then I can go ahead and document outside.